Hello everyone, this is Dr. Rita Khan and welcome back to my channel Medicosguide. In part A, there was an introduction to infant reflexes and stereotypies. Now in part B, we'll dive deeper into specific examples of reflexes and explore them in greater detail. So let's get started. Reflexes as diagnostic tools. Reflexes can also be used as diagnostic tools to identify potential developmental issues. Some examples include Milani Comparative Neuromotor Development Examination and Primitive Reflex Profile. We'll have a closer look at them later in this video. As diagnostic tools, reflexes can determine level of neurological maturation. Since reflexes are age-specific in normal healthy infants, severe deviations from normal time frame may indicate neurological immaturity or dysfunction. Also, reflexes should be tested carefully and only by trained professionals. It requires a quiet state. If the baby is restless, crying, sleepy, or distracted, he or she may not respond to applied stimulus. Now, considering their roles as diagnostic tools, what may be the concerns in following reflexes? A motor reflex may signify cerebral birth injury if it's lacking or asymmetric. On the other hand, asymmetric tonic reflex may indicate cerebral palsy or other neurological problem if it persists past normal time. Now let's take a look at some instances where reflexes are used as diagnostic tools. So the first one is Milani Comparative Neuromotor Development Examination. It measures several infant reflexes from birth to 24 months. It develops profile of child's movement in relation to what is expected at a specific age. And it is especially valuable with children suspected of motor delay. Now the next one is Primitive Reflex Profile. So, this includes quantification of the level of presence or strength of primitive reflexes. It incorporates three reflexes: motor reflex, asymmetric tonic neck reflex, and symmetric tonic neck reflex. And it has 5-point classification system: 0 for absent, and force was so strong that it dominates individual. Now, if we talk about number of infant reflexes, we must keep in mind that different terminologies have been used for same reflex by experts. For example, rooting reflex has been named search reflex, or it can also be regarded as cardinal points reflex. And reflexes are often poorly defined and more complex than they were once thought. Now let's have a look at examples of primitive reflexes, and these are palmar grasp, sucking, surge rooting, moro, startle, asymmetric tonic neck, symmetric tonic neck, plantar grasp, Babinski, palmar mandibular, and palmar mental. Now let's discuss them one by one. Okay, so the first one is palmar grasp. When the palm is stimulated, four fingers, not thumb, close, and the duration of it is from 5 months gestation to 4 months postpartum. And if there is no palmar grasp, this may indicate neurological problems, especially flaccidity. This is one of the most noticeable reflexes, and this may lead to voluntary reaching and grasping. And this may also predict handedness in adulthood. Now, the next one is sucking reflex. When there is touch of lips, this stimulates sucking action. It starts in utero and lasts for 3 months postpartum. If there is no reflex, this is problematic for nutrition, and it is often present in conjunction with surging reflex. Now we have surge reflex. When the cheeks are touched, head moves towards stimuli, and duration of it is from weeks prenatal to 3 months postpartum. Now, if there is no reflex, this is problematic for nutrition. And if there is no reflex or if there is lack of persistence, it may be a sign of CNS or sensory motor dysfunction. It is often present in conjunction with sucking reflex, and it contributes to head body rightening reflexes. Moro reflex. Now there can be two stimuli. If there is suddenly but gently lowering of baby's head, or if there is hitting of the surface beside baby, what would happen? This would cause extension of arms and legs. Now its duration is from prenatal to 4 to 6 months postpartum. And if this reflex lacks, it would signify CNS dysfunction. If it persists, this may signify sensory motor problem. If it persists, this can also delay sitting and head control. And this may indicate injury to one side of the brain if it's asymmetrical. Now, reaction time increases with age, and this motor reflex precedes startle reflex. Okay, so what is startle reflex? This is same as motor reflex, but the difference is that here there is flexion of arms and legs. And this reflex appears 2 to 3 months after motor disappears, and it lasts till 1 year. And throughout the lifespan, this is less severe. Now, asymmetric tonic neck reflex. When the baby is positioned prone or supine and his or her head is turned to one side, limbs would flex on one side while they extend on the other side. And duration is after birth to 3 months. And this reflex can be inhibited by bilateral body awareness or by the hand eye coordination. Now, asymmetric tonic neck reflex also has some alternative names which are bow and arrow position or fencer's position. Okay, so the next reflex is symmetric tonic neck reflex. So here we can have two situations. If the baby is sitting up and tipped forward, then the neck and arms would get flexed while the legs would extend. While if the baby is sitting up and tipped backward, then the neck and arms would extend while the legs would flex. And the duration of this reflex is from after birth to 3 months. And if it would persist, then this may impede many motor skills and can cause spinal flexion deformities. Plantar grasp. When the ball of the foot is touched, this would stimulate toes grasping, and it lasts from birth to 1 year, and it must disappear before the baby can stand or walk. Next is Babinski reflex. When there is a stroking of the bottom or the lateral portion of the foot, great toe turns downward, and duration of it is from birth to 4 months, and this is basically a test of pyramidal tract which is responsible for ability to perform conscious movement or voluntary movement. Now we have palmar mandibular reflex. Now here the stimulus can be pressure to both palms, or if the baby would grasp the hair in his hands, then what would happen is that the response would be eyes would get closed, mouth would get opened, and the neck would get flexed. So this basically tilts the head forward. And duration of it is from birth to 3 months, and this is also called back end reflex. And now the last example of primitive reflex is palmar mental reflex. Now here basically the scratching of the base of the palm would cause opening or closing of the lower jaw, and its duration is from birth to 3 months. Okay, so that's all for today's video. In this video, we have discussed in a great detail about how reflexes can be used as diagnostic tools, as well as we had a deeper look into all examples of primitive reflexes. And in the last part of this video, we'll be discussing about the examples of postural reflexes as well as what are stereotypies. So stay tuned. Thanks for watching, and don't forget to like, share, and subscribe. Until then, take care.